Hi there, my name is Milan and I'm the lead occupational therapist here at Cutting Edge Mansfield.
I'm Stephanie. I'm the lead speech therapist in Mansfield.
And today we're going to be talking a little bit about the differences between the educational model versus the medical model of therapy. So the educational model, the purpose of therapy within the school is to support the child in their academic career. So if there's any type of barriers that the child may be having that's preventing their success in the schools, then therapy services may be required in the school district. Medical model is a little bit different between the two. So
Yeah.
Stephanie can probably talk to you a little bit about that.
So, the medical side of things, we look at it for more of a holistic approach of how their functioning is being impacted across their environments, with their family, with their friends, and also just their individual functioning across the board. We can look at it more from a perspective of medically, how can we intervene, as well as looking how they are with peers in more of an unstructured way versus in the educational system, it's more of directly impacting their education.
Absolutely, absolutely. The setup of therapy may be a little bit different in a medical setting versus a school district. Typically, there will be an IEP that the child would receive, listing out the recommendations for the child. So it may be speech therapy, it may be occupational therapy, physical therapy, and they'll probably make recommendations to the teacher about some things that they can do. And if they do happen to pull out the child, they may do that maybe once a week, once a month, just depending on the services that's required. They really want to try to keep the child within the natural environment of school as much as possible.
Yeah, so for the medical setting, we look more individualized sessions. So we have one on one sessions where they're just with us. Sometimes we'll have another peer involved, but that other therapist will be with the peer too. So we do a lot of one on one therapy. When we do our plan of cares, we do a lot of collaboration and consulting with the family. If the patient is able to, we consult with the patient and what their needs and wants are, as well as sometimes we will even reach out to the school to see what they're working on. So that way, we really go at it from all angles and try and make sure what we're doing is going to be the most functional for them and give them the most potential for success.
Absolutely. So, if your child is receiving school therapy services, it may be important for you for us to reach out to that school therapist, like Stephanie was saying. So, they may be getting speech therapy in the school. We'll go over what they're doing in the school setting. The school will go over what they're doing in the school setting, the school therapist, and then medically, we'll probably have some different goals compared to the school because, like I mentioned before, their goals are going to be set more for what's supporting them within the walls of the school district, and then the medical model will probably be working on similar goals, but it'll be more geared towards their everyday life. So if your child is receiving school therapy services and you're kind of wondering, hey, can my child benefit from outpatient therapy services? We do have free screenings here, and one of our clinicians will be able to sit down and either talk to you or look at your child to see whether or not you may benefit from your child may benefit from outpatient services.
Yeah.
So.
We also see a very big difference sometimes in the educational model offering more of a group therapy approach. Typically, the setting has more of a situation that 5 students will be together, one therapist at that time working with them for 15 minutes, like Milan said, one time a week, maybe 5 times of 6 weeks, things like that, versus for our model, it's that one-on-one, potentially one time a week, but we do go up to multiple times a week. We do review their goals often, and we do have family debriefs after every session. So a lot of involvement with the family, so that way we can make sure it's generalizing to the home environment.
Absolutely. So if you have any questions, please feel free to reach out to us, and have a great day.